The wind hammered the glass doors of Mile High Regional. Outside, Denver vanished in a whiteout siren swallowed by the storm. Inside Trauma Bay. The air smelled of bleach. The doors burst open. A stretcher slammed through. Its wheels left wet tracks pink against the tile under harsh lights above. 35 male, the paramedic shouted. Neck laceration arterial. We lost pressure twice. Blood fanned across the sheet in bright pulses. A resident reached for gauze. Where's Dr. Ross? Someone asked. Stuck in traffic. 20 minutes. Another voice answered. Avery Quinn stood near the supply cart chart in her hand. Night shift nurse. 3 months on this floor. The kind of person people nodded at and forgot. She watched the red spray and felt a familiar click behind her ribs, like a latch coming undone. More light, she said. The resident blinked. Nurse, just hold pressure. Avery stepped in anyway. Her fingers didn't smash down. They searched, sliding through torn tissue with steady patience. She found the vessel, felt it jump under her touch, then pinched just enough to quiet the fountain. Suture 6-0-proline, she said. A scrub nurse hesitated, then placed the needle driver into Avery's palm. Avery's wrist rotated. The needle entered, emerged, looped, and locked. Twice. Her hands moved fast, but not frantic. Clean. Certain. 3 seconds and the pulsing stopped. The monitor tone steadied from panic to rhythm. The room went still. Someone exhaled a shaky sound. The trauma bay doors opened again, slower this time. Dr. Ethan Ross walked in with snow clinging to his coat collar. He took one look at the patient, then at Avery's gloved hands resting on the stitched line. His eyes narrowed, not in anger, but in calculation. Who taught you that? He asked. Avery peeled off her gloves 1 finger at a time. I just did what I could. He was bleeding out. Ross stepped closer. That was a vascular closure, not pressure, not luck. Avery kept her face blank. The patient's stable. He needs CT and OR. Ross held her gaze like he could pull the truth out through sheer force. After you hand off, you come with me. It can wait, she said. It can't, Ross replied, quiet and final. Before we dive into what happens next, I would love to know where you are watching from. Drop your city or country in the comments. Ross did not raise his voice. He did not need to. The way he said it made the whole trauma bay feel smaller. Avery turned back to the stretcher and forced her hands to keep moving. She spoke to the resident as if nothing had happened. Get him to CT. Call vascular. 2 large bore lines. Keep pressure stable. Her tone gave people something to follow, and the room snapped back into motion. As they rolled the patient out, Avery wiped the blood from her wrists at the sink, slow and thorough. The water ran pink, then clear. Her pulse refused to settle. She caught her reflection in the stainless steel eyes, too bright face, too calm. Calm was a mask she had worn for years. Ross waited by the door, arms folded. He held himself like a man used to rooms changing shape around him. When Avery approached, he stepped aside just enough to let her pass, then fell in beside her. They walked through the corridor that connected the trauma pods to the administrative wing. Fluorescent lights buzzed overhead. A janitor pushed a mop bucket past them and glanced up then away, as if he felt the tension and did not want to be touched by it. Avery tried to keep her pace neutral. Not hurried, not reluctant. Just another staff member being called to a quick meeting. But she could feel Ross watching her profile, tracking every breath. His office sat at the end of a quiet hall. Frost clung to the edges of the narrow window. Ross opened the door and held it while she entered, then shut it behind them with a soft, deliberate click. The room smelled like coffee that had been reheated too many times. One wall held framed diplomas and a photo of a surgical team in front of a helicopter. Another wall was a dry erase board filled with notes and case times. His desk was tidy but not fussy. A man who liked control, not decoration. Ross did not sit. He leaned against the desk instead, close enough to block the most direct path to the door. Sit, he said. Avery stayed standing. You pulled me off the floor. Make it quick. Ross's mouth tightened. He picked up a tablet from the desk and tapped the screen. Avery Quinn. Nursing license valid. References check out. Employment history starts 3 years ago in Spokane. then 2 travel contracts, then here. Avery kept her face blank. That's what happens when people move. Ross angled the tablet toward her. No social media, no old address, no college photos, no friends listed, no professional profile, not even a court record for a parking ticket. Avery shrugged. Some people like privacy. Some people are running, Ross said. Silence sat between them, heavy and intimate. The storm rattled the window like impatient knuckles. Ross tapped the screen again. Tell me where you learned that closure. Avery held his gaze. On the job. You see enough blood, you get good at staying calm. You did not stay calm, he said. You performed. Avery forced a small laugh. I held pressure and got lucky. Ross's eyes flicked not to her face, but to her hands. Lucky does not tie a knot like that. Lucky does not place a needle at that angle. Lucky does not find a torn vessel with 2 fingers and close it as if the tissue is talking to you. Avery felt her stomach drop. She kept her posture steady anyway. You're seeing things. I have been a surgeon for 16 years, Ross said. I have watched hundreds of repairs. I have watched mistakes. I have watched miracles. What you did does not belong to a nurse with 3 months in an emergency department. He pushed off the desk and walked to a cabinet. When he opened it, Avery saw bottles of sanitizer, spare gloves, and a metal box with a combination lock. He did not touch the lock. He closed the cabinet and returned to her. That technique, he said, I have seen it once. Avery felt the room tilt just slightly like an elevator stopping. Ross continued, voice low. Dr. Madeline Keats. Avery did not blink. Her throat went dry so fast it hurt. Ross watched her closely. 5 years ago, she was the name everyone said with admiration, then with venom. A cardiothoracic prodigy. Fast hands. Cleaner sutures than anyone in my fellowship class. She disappeared after a high-profile death in Seattle. Avery's jaw tightened. I don't know what you're talking about. Ross nodded as if he expected that answer. The patient was Noah Price, son of Senator Halston Price. He died on the table. The senator went public, called her reckless, demanded accountability. The board opened an investigation. The media did what it always does. Avery's fingers curled at her sides. She could feel her nails pressing crescent moons into her palms. She wanted to tell him to stop saying the name, to stop pulling those memories into the air like smoke. Ross took a step closer. Keats would be about your age now. Similar build. Same posture. Same way of holding your shoulders when you think no one is looking. Avery's voice came out steady, almost bored. You're mistaken. You want a mystery. You found a tired nurse and decided to make her a story. Ross held up one hand. Avery's eyes snagged on it before she meant them to. His fingers trembled. Not much. A faint flutter, like a leaf vibrating in a breeze. He closed his hand into a fist, then opened it again, trying to stop it by sheer will. Do you see that? He asked. Avery said nothing. Ross's eyes hardened, then softened in the same breath. It's getting worse. Avery's chest tightened. She had seen surgeons shake from exhaustion, from adrenaline, from too much coffee. This was different. This was there, even in stillness. Ross exhaled. Early onset. No one here knows. Not the board, not my department, not my family. I have 6 months, maybe less, before I can't hide it. Then my surgical privileges get reviewed. Then I lose the work that built my life. Avery heard the rawness in his voice and hated herself for hearing it. Sympathy was dangerous. Sympathy made you stay in rooms you should leave. She kept her tone flat. I'm sorry, but that has nothing to do with me. It has everything to do with you, Ross said. Because you were not improvising back there. You were remembering. Avery turned toward the door. Ross did not move to stop her, but his voice caught her like a hand on her shoulder. I am not trying to ruin you, he said. If I wanted to, I could call the board right now. I could call a reporter. I could do what people did to Keats. Avery stopped. Her heartbeat thudded in her ears. Ross stepped to his desk and slid a folder across the surface. Not a thick one, not a formal one, more like something printed in a hurry. A case came in tonight, he said. Not the neck laceration. Another patient. 42 male suspected aortic dissection. He's upstairs in imaging now. The storm has shut down transport to Colorado Springs. The helicopters are grounded. We are the only option he has. Avery did not reach for the folder. Ross's voice stayed controlled, but Avery could hear the pressure behind it. If it is what I think it is, he will need a repair by morning. He will need speed, precision, a steady hand. Avery swallowed. You have a team. Ross's eyes met hers. My team follows my hands. Avery forced herself to breathe. Then get another attending to cover. I already tried, Ross said. 2 are out of state. 1 is sick. 1 refused the case because of the storm and the liability. Avery let out a small, humorless sound. Liability. That word had eaten half her life. Ross leaned forward slightly. I am not asking you to take the case alone. I am asking you to help me. Teach me how to compensate. Guide me through the steps. If your hands are what I think they are, you can keep him alive. Avery stared at the folder. Her mind flashed to a familiar set of sensations, the weight of a needle driver, the hum of a bypass pump, the silence that falls in an operating room right before something goes wrong. She shook her head once. I can't. Ross did not argue. He simply spoke as if he had already turned over every stone in his own mind. When I looked into the Keats case, he said I found something strange. Avery's eyes snapped to his. Ross's voice dropped. Noah Price's records were incomplete. Not medically incomplete. Intentionally incomplete. There were gaps where there should not have been any. A family history that did not match what later showed up in private notes. Avery felt a cold wave move through her body, starting at her spine. That's not possible, she said, and the words came out too fast. Ross held her gaze. You did not make a mistake. Avery's breath hitched. She tried to hide it. She failed. Ross set his hands flat on the desk, pressing them down as if he could pin the tremor and the truth at the same time. I read every page I could find. I talked to people who would not go on record. I compared what the hospital filed with what the autopsy later suggested. Someone wanted that surgery to end the way it ended. Avery's mouth went dry again. The office felt hotter, the air thicker. Ross continued, voice steady, almost gentle now. If you are Madeline Keats, then you have been carrying a lie that was never yours. And if you are not, then I am losing my mind. Avery stared at him, at the controlled urgency in his face, at the faint tremor he could not fully hide, at the folder that might hold a stranger's life. Her voice came out quiet. Why are you telling me this? Ross did not look away. Because I think you were set up. Avery held Ross's eyes, waiting for the punchline that never came. His face stayed still, but the muscles along his jaw worked as if he were chewing through something bitter. Set up, she repeated, like the word had edges. You do not know that. I do not say things like that unless I have reason, Ross replied. I have reason. Avery's throat tightened. She looked at the folder again, then passed it toward the window where the storm painted the glass white. The building hummed, with generators and ventilators, with the steady heartbeat of a hospital that never truly slept. She had built her life inside that hum because it asked nothing of her except competence and silence. Ross watched her hands. You flinched when I said the name. People flinch when you accuse them of being a ghost, Avery said. I did not accuse you, Ross replied. I recognized you. Avery's mouth opened, then closed. She stepped closer to the desk and placed 2 fingers on the folder, not picking it up, just grounding herself. The paper felt thin, harmless. She knew better. Paper had ruined her once. You read the case file, she said. Then you know what happened. You know why she disappeared. I know what the public was told, Ross said. I know what the board wrote. I know what the news anchors repeated until it sounded like truth. I also know what does not fit. Avery's breath came shallow. The office was too warm. The lights were too bright. She could hear the faint tick of the wall clock each second, landing like a tap on bone. Say I am her, Avery said softly. What do you want from her? Ross did not hesitate. I want her to save a man upstairs. I want her to stop hiding long enough to do what she does best. And I want her to help me stay useful while my hands betray me. Avery let her fingers slide off the folder. That is a lot to ask. It is, Ross said. But you already answered once in Trauma Bay 2. You stepped forward when everyone else froze. Avery felt the memory surge up sharp and unwanted. The stretcher, the arterial spray, the resident's wide eyes, her own hands moving before permission, before caution, before fear. She had told herself it was reflex. She had told herself it was an accident. It had felt like coming home. She turned away from Ross and faced the diplomas on the wall, the framed photo of his team. Smiling faces, bright sun, a helicopter behind them. People who looked unafraid of being seen. Avery's voice came out quiet. I had a different name. Ross did not move. He only nodded once, as if he had been waiting for that door to open. Avery swallowed Madeline Keats. The name sat in the air, heavy as a wet coat. It sounded strange on her tongue after years of not saying it aloud. She waited for Ross to react with triumph, with judgment, with the hunger people always carried when they thought they had caught her. Instead, he simply breathed out. Thank you, he said. Avery laughed once, short and sharp. Do not thank me. That name is not a gift. It is a match. Ross's gaze stayed steady. Tell me what you need. Avery's eyes stung. She hated that too. Tears felt like weakness, and weakness felt like danger. She pushed the feeling down and let her mind slip back, not as a story, but as a series of images that still lived under her skin. A bright operating room in Seattle. The sterile blue of drapes. The soft, constant whir of the bypass machine. A young man on the table with a face too calm for the chaos inside his chest. Noah Price. She remembered the first incision, clean and confident. She remembered the way his aorta looked a little too delicate, as if it had been built from thin paper instead of muscle. She remembered the moment it tore in a way it should not have, the sudden flood of blood, the fast, desperate choreography of hands and clamps and suction. She had done everything right. She had checked her steps twice, then a third time. She had trusted the chart. She had trusted the history. She had trusted the system. Then the monitor went flat. Afterward, a hallway of reporters, cameras like eyes, voices shouting her name, her face, her guilt. A giant screen in a waiting room showing Senator Halston Price at a podium, grief sharpened into a weapon. My son is dead because of negligence, he had said. Because people in white coats think they are untouchable. Avery remembered sitting at her kitchen table while the news played on repeat. Her phone buzzing, buzzing, buzzing. Unknown numbers, threats, rage. A voicemail that said she deserved to die the same way. She remembered walking into the hospital and feeling the air change. Colleagues who once joked with her now stared at the floor. Nurses who used to greet her in the hall now slipped past like she carried infection. She remembered the board, hearing the long conference table, the lawyers speaking as if she were not in the room. She remembered being asked why she did not anticipate a genetic condition that had never been disclosed, never documented. She remembered signing papers with shaking hands, not because she was guilty, but because she was trapped. Then she remembered the moment she decided to disappear. A duffel bag, a cheap motel, her medical license suspended, her name turned poisonous. She had boarded a bus with her hood up and her head down, leaving behind a career she had carved out of sleepless nights and steady hands. Spokane came next, not because she chose it, but because it was far enough anonymous enough. She had walked into a small nursing program under a new name and asked for a second chance. Avery Quinn, a version of herself built to survive. Avery came back to the present with a small gasp, like breaking the surface of dark water. Ross's voice was gentle now. You did not deserve what happened. Avery shook her head. Deserve does not matter. Ross reached for the folder, then stopped himself as if touching it might break the fragile truth they had just placed on the table. I know you changed your name, he said. I know you rebuilt. I will not take that from you. Avery's eyes narrowed. Then why bring me into your office? Because a man upstairs will die if we do nothing, Ross replied. And because I cannot pretend my hands are reliable for a case like this. Avery looked at his right hand again. The tremor was subtle, but it was there like a whisper that refused to be silenced. She pictured him in an operating room with a chest, open a fragile vessel, exposed a clamp that needed to land in exactly one place. She pictured the wrong movement, the wrong angle, the wrong second. She felt the old instinct rise fierce and familiar. Fix it. Control it. Save the life in front of you. It is always a man with a clock over his head, she murmured. Ross's eyebrows lifted. What? Nothing. Avery exhaled through her nose. Show me the scans. Ross moved quickly, relief flashing across his face before he hit it. He turned the tablet toward her and tapped. Images appeared crisp and clinical. Aorta. Arch. A jagged line where there should have been smooth continuity. The dissection snaked downward like a crack in glass. Avery leaned in. The world narrowed. Her breathing slowed. The noise of the hospital faded until there was only anatomy and risk. This is extensive, she said. Starts near the arch and runs past the renal branches. Ross nodded. Radiology called it a type A with distal extension. Avery studied the branching vessels, the thinness of the wall, the shadow of impending rupture. His blood pressure, unstable, Ross said. He is on meds to keep it down, but he keeps spiking. Avery's mind ticked through the steps she had not allowed herself to think about in years. Cannulation, bypass, cooling, arrest, graft selection, anastomosis, the order of moves that felt like choreography. She hated how familiar it felt. Most surgeons will not touch this in a storm, she said. Ross met her eyes. Most surgeons are not you. Avery looked away. Compliments were traps. They made people careless. Who is he? She asked. His name is Liam Mercer, Ross said. 42. Works construction. 2 kids. His wife is in the waiting room asking if he will wake up. Avery felt a twist low in her stomach. Ordinary people. The ones who did not have lawyers parked in hallways. The ones who could not buy a new life when theirs cracked. If you transfer him, he dies, Avery said. Ross nodded once. The roads are closed. The helicopters are down. The storm will not lift until morning. Avery straightened. I do not do this, she said, the words harsh. I do not go back into an operating room as Dr. Keats. I did not come here to be that person. Ross's voice stayed calm. Then go in as Avery Quinn. Go in as a nurse who happens to know how to keep a man alive. Avery let out a breath that sounded like a bitter laugh. That is not how it works. It can, Ross said. In this hospital, it can. I have authority in the trauma service. I can credential you as a surgical assist for emergencies. I can document it as a life-saving intervention during a disaster event. The storm gives us a reason that no one can argue with. Avery stared at him, searching for the angle, the hidden motive. She found one, but not the one she expected. He was scared. Not of being exposed, not of losing status. Scared of being useless while someone bled out. Avery's voice softened despite herself. And what do you get? Ross hesitated. His right hand twitched once, then stilled when he pressed it against the edge of the desk. I get a chance to do my job without killing someone, he said quietly. I get to learn how to adapt before I am forced out. And you get to keep your secret. I will not say your name to anyone. Avery's pulse hammered. She pictured the headlines, the old ones, the kind that ate people alive. She pictured her apartment door with notes stuck to it. She pictured strangers spitting her name like a curse. Then she pictured Liam Mercer's wife in a plastic chair, hands clasped, begging into the emptiness. Avery picked up the folder at last. Her fingers steadied around it, sure in a way her heart was not. If I help, she said, it is one case. Not a return, not a reunion tour. One case. Ross nodded. One case. Avery's eyes narrowed. And I call it, if your hand shakes at the wrong moment, you step back. Ross swallowed, then nodded again. Agreed. Avery looked at the clock on the wall. Time moved whether she was ready or not. Where is he now? ICU, Ross said. They are keeping him sedated to control the pressure. We have hours, not days. Avery turned toward the door, then paused with her hand on the knob. She did not look back when she spoke. You said you found gaps in Noah Price's record, she said. If that is true, someone did not just ruin my career. Ross's voice came from behind her steady. Someone wanted a death. Avery opened the door. The hallway air felt colder, sharper. She stepped out and started walking, keeping her pace even, her shoulders relaxed, her face unreadable. Ross followed beside her. As they approached the ICU doors, Avery heard the distant beep of monitors and the low murmur of nurses changing shifts. The sound settled into her bones like an old song. She kept her eyes forward. Operating room 3, she said, not quite a request. First case, 6 in the morning. Ross's breath caught, then he nodded. I will make it happen. By 5:15, the hospital felt like a ship sealed inside ice. The windows were white with snow, the entrances guarded by drifts piled chest high. Inside the halls stayed bright and warm, but the storm leaked into everything anyway. It lived in the way people spoke softer, in the way security checked badges twice, in the way the overhead announcements sounded a little too calm. Avery changed in a locker room that smelled of bleach and damp cotton. She pulled on scrubs that did not quite fit her shoulders and tied her hair back with steady hands. In the mirror, she looked like she always did here. Anonymous, useful, safe. Her throat tightened as she washed at the scrub sink. The soap foam slid over her fingers, over the faint scars no one ever noticed. She kept her eyes on the clock above the door, watching seconds march forward. Ross appeared at the edge of the sink area, already gowned cap pulled low. His face was drawn, but his posture stayed composed, as if he could stand tall enough to keep the building from shaking. You ate? He asked. Avery stared at the water streaming from her fingertips. No. Ross nodded once. After. Avery glanced at his right hand. It was still, but she could see the effort it took to keep it that way. The kind of stillness that came from gripping an invisible railing. They stepped into operating room 3 together. The lights hit like a memory, bright and unforgiving. The room smelled of sterile drapes and warm plastic. Machines waited in neat rows, their screens glowing like quiet eyes. A bypass cart sat ready near the wall lines, coiled like pale snakes. Liam Mercer lay on the table under a blue field of drapes. His skin was already pale, his chest rising and falling under the ventilator. The anesthesiologist looked up as Avery entered. Pressure is holding, the anesthesiologist said. Barely. He spiked twice, at 4. We pushed meds. Avery moved closer and looked at the monitors. Numbers flickered, then steadied. She listened to the tone of the heart rate, to the rhythm behind the data. It sounded like a man balancing on a ledge. Ross spoke to the team, his voice clear. We are doing a complex type A repair with distal extension. We will move efficiently. No shortcuts. Avery scanned the faces in the room. 2 residents, both alert and tense. A perfusionist with calm eyes. Scrub tech she recognized from nights. And a circulating nurse she did not know, a woman with dark hair tucked into a cap and a badge turned inward so the name was hidden by a fold of fabric. The woman's gaze met Avery's for a beat too long, then slid away. Avery felt a flicker of unease, quick as a pulse, then pushed it down. You could not carry unease into a room like this. It would crawl into your hands. Ross took position at the head of the table. Avery stood opposite him, close enough to see the fine tremor when he flexed his fingers far enough to move if the room went sideways. Time out, the circulating nurse said. The team stated names, procedure patient. Avery gave the name she lived under. Avery Quinn, RN. Ross's eyes did not move when he said his. Ethan Ross, attending, Incision Ross said. The scalpel flashed. Skin opened cleanly, the residents retracted. The sternum saw wind, then stopped. The chest spread open under metal, and the warmth of living tissue filled the room. Avery's focus narrowed. The aorta came into view, swollen and wrong, its wall bruised with the hidden violence inside it. The dissection line looked like a crack in old paint. Ross pointed with a gloved finger. There. It is worse than the scan. Avery leaned in. The tissue was thinner than she liked. It shivered with each pulse. We cool early, she said, and we move the cannulation to avoid that segment. Ross nodded, agreed. They went on bypass. The perfusionist called out flow and pressures. The room fell into the steady cadence of a procedure that demanded both speed and patience. For the first 40 minutes, Ross's hands held. His movements were careful, deliberate. He let the residents do small tasks, but he kept the critical steps close. Avery stayed quiet, speaking only when necessary, guiding without taking over. When the time came to open the aorta, Ross paused. Avery saw it in his shoulders first. A faint stiffness like a man bracing for a gust. Ross took a breath and made the cut. Blood welled, controlled by bypass and clamps, but the wall fought every instrument. It tore where it should have held. Ross adjusted his grip, and Avery saw the tremor twitch through his right hand, a brief shudder. He froze for half a second. Avery leaned in, voice low. Left hand. Anchor with the left. Ross shifted. He steadied. He moved on. They excised the damaged section piece by piece until the jagged line of dissection gave way to edges that could accept a graft. The residents suctioned and retracted, their eyes wide above masks. Avery watched. The tissue watched Ross, watched the monitors. Then it happened. Ross reached for a clamp to reposition it along a fragile branch. His fingers tightened. The tremor hit harder, sharper, like a sudden jolt through a wire. The clamp slipped. The vessel wall tore. Blood surged into the field, dark and fast, filling the space between ribs and retractor arms. The monitor tone changed. Urgent high. Suction, Ross snapped. The resident fumbled, then recovered. The suction roared. Avery did not wait. She stepped in, shoulders over the wound, hands moving without thought. Her fingers found the tear by feel, not sight. She pressed, then shifted pressure in a precise arc, pinching the flow down to a manageable thread. Clamp, she said. A metal instrument landed in her palm. She set it exactly where it needed to go, the way a musician lands a note. The bleeding slowed. The field cleared. The anesthesiologist's voice came sharp, pressure dropping. We are at 65 atm. Avery held steady. Give volume. Increase flow. The perfusionist adjusted. The monitor crept back upward. Ross stood back a fraction, eyes locked on Avery's hands. His face was pale above the mask, but his voice stayed controlled. Take over, he said. Avery's jaw tightened. No. Ross's eyes narrowed. That was not a request. Avery kept pressure with one hand and used the other to adjust the clamp. You stay. You retract. You document. You do not touch anything that matters until I tell you. A quiet beat. Ross nodded. Done. Avery shifted position at the table and took the needle driver from the scrub tech. The instrument felt like it belonged there, like it had been waiting. She did not announce what she was doing. She just did it. Needle in, out, tie, again. Her hands moved fast, but every movement had purpose. She repaired the tear, reinforced the edge, and moved on, building stability, one stitch at a time. The residents followed her cues. They adjusted suction before she asked. They moved retractors without blocking her line of sight. The perfusionist tracked her rhythm and matched it with flow. Ross held retraction with his left hand and kept his right close to his body, pressed against his gown, as if he could hide it there. The circulating nurse, the one with the hidden badge, moved around the room silently. She checked the instrument count, log times, adjusted lights. Once Avery caught her watching again, eyes sharp, measuring. When Avery met her gaze, the woman looked away and turned toward the wall phone near the door. Avery's focus snapped back to the open chest. Liam's aorta demanded everything. There was no room for paranoia, only precision. They replaced the damaged section with a graft. Avery sutured the proximal anastomosis, then the distal. The tissue was brittle, but she treated it like glass, never forcing, never rushing the wrong step. 2 hours passed, then 3. Sweat gathered at Avery's hairline under the cap. Her shoulders burned. Her fingers stayed steady anyway. The work was exhausting in the way only quiet work could be, the kind that drained you from the inside out. Finally, the last suture line held. The graft sat clean, aligned, pulseless under bypass. Rewarm, Avery said. The perfusionist complied. The anesthesiologist prepared for separation. As the body warmed, the heart began to take back its job. The monitor shifted from machine-driven regularity to a living rhythm. The tone softened. Liam's pressure held without screaming alarms. Coming off bypass, the perfusionist announced. Avery watched the numbers, 70, 80, 90. Stable, the anesthesiologist said, and the word sounded like a blessing. Avery stepped back. Her hands trembled for the first time, not from fear, but from release. She forced them still and looked at the field one last time. No bleeding, no seep, nothing hidden. Close, she said. The residents moved in eager, relieved their voices quiet. The sternum came together, wires twisted, layers closed. When the drapes finally fell away and the room began to decompress, Avery stood at the sink, washing in silence. The water ran over her wrists, over dried specks of blood, over skin that felt too thin. Ross came up beside her and scrubbed his hands slower than usual. His tremor had returned in small waves now that the pressure had lifted. You saved him, Ross said. Avery kept her eyes on the sink. We did. Ross's gaze lingered on her, then dropped. You did not have to stay. Avery turned off the water. He did not have anywhere else to go. Behind them, the circulating nurse with the hidden badge slipped toward the door. As she passed, Avery heard the soft click of her phone screen waking, then the muted sound of a call connecting. Avery dried her hands and pulled off her cap. Her hair clung damply to her forehead. She stepped out of the operating room beside Ross, into the corridor that smelled of cold air and coffee from the staff lounge. The hallway was mostly empty at this hour. Snowlight filtered through small windows, turning everything blue. Then Avery saw her. A tall woman stood near the waiting area doors, coat draped over one arm, the kind of coat that did not belong in a storm because money could make storms optional. Her blonde hair was perfect, her expression too composed for a hospital hallway. She looked up as Avery and Ross approached. Her eyes locked on Avery's face, and something in them sharpened like recognition, turning into certainty. Ross shifted half a step in front of Avery, instinctive protective. The woman smiled, small and controlled. Madeline Keats, she said. Or are you going by Avery Quinn now? Avery felt the words land in her chest like a cold weight. She did not move. For a second, she could only hear the distant squeak of a cartwheel and the low hum of ventilation in the ceiling. Ross shifted closer, making his body a barrier. This is a restricted area, he said. His voice had a calm edge that made it sound like a command dressed as a courtesy. You need to leave. The woman studied him, then looked past him at Avery again. She was tall, her hair smooth and bright under the hallway lights, her coat draped over one arm like the storm outside could not reach her. Her eyes did not flicker. They pinned. I am not here to cause a scene, she said. I am here to talk. Ross did not budge. Talk to me. You do not talk to my staff. The woman's mouth tightened into something that almost passed for a smile. Your staff just performed a repair no nurse could do. Avery's pulse throbbed in her throat. She could feel the surgical tape tug at the skin on the back of her neck, left over from the cap she had ripped off too fast. She forced her hands to stay at her sides. Ross glanced at Avery, a quick look that asked a question without words. Avery answered the way she had learned to answer everything. She kept her face empty. She stepped around Ross before her instincts could stop her. It's fine, she said. Ross's head turned sharply. Avery. I can handle it, she said, and the name tasted like a lie she had chewed on too long. The woman watched that exchange with a quiet satisfaction, like she had just confirmed something she already knew. Avery turned her gaze to the waiting room doors. There's a consult room down the hall. The woman nodded once. Good. Ross moved with Avery staying beside her. No, he said, under his breath. This is not fine. Avery kept walking. The hallway felt longer than it had minutes ago. Her shoes squeaked on the polished floor, a small sound that made everything too real. They reached a small consultation room with a table, 4 chairs, a box of tissues, and a framed print of mountains that looked like someone's idea of comfort. Avery opened the door and stepped inside first. Ross tried to follow. Avery blocked him with her shoulder, gentle but firm. Stay outside, she murmured. Ross's eyes darkened. You do not know what she wants. Avery held his gaze. I do. Ross looked like he wanted to argue, Then he took a slow breath and stepped back. "I am right here," he said. Avery nodded once and closed the door. The room fell quiet in a way that pressed against her eardrums. The woman set her coat over the back of a chair without sitting. She stood close to the door as if she liked being near an exit. When she spoke, her voice was smooth, practiced. "You look different," she said. Shorter hair, no makeup, no arrogance. Avery felt a flare of heat, then forced it down. "I don't know you." The woman's eyes sharpened. "You know exactly who I am." Avery did not answer. The woman took a small breath, her nostrils flaring like she was steadying herself. "Kendall Price," she said. "Noah's sister." The name pulled the room backward in time. Avery smelled antiseptic and hot metal again. She heard the flat line tone that had haunted her sleep. She felt her hands slick with blood, trying to hold together tissue that wanted to fall apart. Avery kept her voice level. "I didn't kill your brother." Kendall's expression tightened. "That is not what the world said." "The world did not stand at the table," Avery said. "The world did not see what I saw." Kendall's gaze did not leave Avery's face. "My brother went in for surgery and never woke up. Then my father went on television and said you were careless. Then you vanished." Avery's mouth went dry. "You think I vanished because I was guilty. I think you vanished because you were scared," Kendall said. Her words came quieter, almost thoughtful. "Scared of my father. Scared of what he could do to you." Avery's fingers curled against her palm. "If you came here to threaten me, you picked a bad place. There are cameras. There are witnesses." Kendall's eyes flicked to the ceiling corner to the security dome. "I am not here to threaten you." Avery let out a short laugh that held no humor. "Then why are you here, Kendall?" Kendall's composure cracked for the first time. Her jaw trembled, then steadied. She reached into her bag and pulled out her phone. She did not hand it over yet. She held it like something fragile. "I know about Marfan," she said. Avery's breathing paused. Kendall watched the reaction she had caused, then continued. "I read the autopsy report. I read every file I could get my hands on. The genetic findings. The notes that never made it into the public record." Avery's voice went thin. "Those findings were not in the chart." "I know," Kendall said. "They should have been." Avery stared at her. "How do you know?" Kendall swallowed. Her eyes flashed with something sharp, then dipped with something softer. "Because my father buried them." The words sat between them heavy and ugly. Avery felt the old rage rise slow and poisonous. She saw Senator Halston Price at a podium, again grief polished into performance cameras, catching every practiced tremor in his voice. She remembered the protesters outside her apartment. She remembered the way her own colleagues had looked through her, like she was already gone. Avery's voice came out cold. "So you came to confess for him?" Kendall shook her head. "I came because he is dying." Avery blinked once. "Good." Kendall flinched. It was quick, but it was real. She exhaled through her nose as if she accepted she deserved that. "He has the same condition," Kendall said. "The same weakness in the vessel wall. The same risk. It runs in the family, and he spent years pretending it did not." Avery leaned back against the table, keeping distance, because distance meant control. "Why are you telling me this?" Kendall lifted her phone and swiped. A series of scans glowed on the screen. Images of an aorta that looked like it was splitting open in slow motion. Measurements, angles, a line of damage that snaked in a way Avery recognized too well. Avery's stomach tightened. "That is a dissection," Avery said. Kendall nodded. "It is progressing." Avery looked up. "Where is he?" "In a private unit," Kendall said. "Not here. Not yet." Avery's lips pressed together. "Then take him to another hospital." Kendall's laugh was a single harsh breath. "No one will touch him." Avery stared. "That is not possible." "It is," Kendall said. "They hear our name, and they think of lawsuits. They think of what happened to you. They think of what my father did on television and what he could do again. They say the case is too risky. They say they do not have the right team. They say transfer would be safer. They say anything to get out of it." Avery felt a chill move through her that had nothing to do with the storm. "And you want me?" she said. Kendall's voice dropped. You did a repair this morning that looks like the one he needs. Avery's throat tightened. You have sources in this hospital. Kendall hesitated, then nodded. I do. Avery's eyes narrowed. You followed me. I needed to know, Kendall said. I needed to know if the story I have lived with for 5 years was true. Avery felt her hands shake just once, a tiny tremor of emotion she hated. She shoved them into the pockets of her scrubs to hide it. And now you know, Avery said. Now you can go tell your father you found the monster. Kendall's face tightened. I did not come here to call you a monster. Avery laughed again, bitter and sharp. You just called me my real name in a hallway outside an operating room. Kendall's voice rose, then caught, and when she spoke again, it was quieter, rawer. Because I needed you to stop pretending. Pretending is easy when someone else is bleeding. Avery stared at her. The anger was still there, hot and alive. But underneath it, something else moved. Something that felt like exhaustion. You think I owe you, Avery said. Kendall shook her head. I think my father owes you more than he could ever repay. Avery's jaw clenched. Then let him pay with the thing he stole. His reputation, his seat, his pride. Kendall's eyes glistened, but she did not let tears fall. He will, she said. If he lives long enough to do it. Avery felt the room tilt again, that subtle sensation of losing the ground under her feet. Kendall stepped closer, slow, careful, as if she knew Avery might bolt. He has weeks, Kendall said. Maybe less. The pain is getting worse. The tear is getting longer. Avery's voice went flat. You could have come to me as Avery Quinn. You could have asked a nurse for help navigating your father's care. You chose this instead. I chose truth, Kendall said. I am tired of lies. Avery stared at the mountain print on the wall, the fake calm of it. Truth did not save me 5 years ago. Kendall's shoulders sagged for the first time. I was 19, she said. I watched my brother die, and I watched my father turn into someone I did not recognize. I believed him because it was easier than believing my family had been hiding something that could kill us. Avery turned back to her. Kendall's face was pale, the skin under her eyes shadowed like she had not slept. Kendall's voice shook. I am not asking you to forgive him. I am asking you to save him. Avery's laugh caught in her throat and died. She pictured Senator Price in a hospital bed, scared helpless, the same man who had once spoken her name like a sentence. She imagined standing over him with a scalpel, her hands steady, her mind full of everything she wanted to say. She also pictured the oath she had taken when she was young, when medicine still felt pure. She pictured a patient who did not deserve her mercy and a daughter who did not deserve to lose the only parent she had left. Avery's voice came out quieter. Why should I do that? Kendall's composure finally broke. Her chin trembled. Her eyes filled and she blinked hard as if angry at herself for it. Because he is my father, she whispered. And I am begging you. The room held its breath. Avery felt her own pulse in her fingertips. She wanted to tell Kendall to leave. She wanted to throw the phone across the room. She wanted to open the door and run down the hall back into the safe noise of the ER, where no one asked her to be a ghost with a name. Instead, she stayed. She looked at Kendall and saw not a senator's daughter in an expensive suit, but a woman gripping the edge of the world with both hands. Avery swallowed. I need time. Kendall nodded quickly. Relief and fear mixing in her face. How much? Avery forced her thoughts into a line. Enough to think clearly. Kendall's voice steadied the politician's cadence, returning like armor, sliding back on. 48 hours, she said. After that, the dissection will decide for you. Avery felt the words land like a countdown she did not want to hear. Kendall picked up her coat. At the door, she paused and looked back, her expression softer, now almost ashamed. I am sorry, she said, for what my family did to you. Avery did not answer. She did not trust her voice. Kendall opened the door and stepped out. Avery heard Ross speak to her in the hallway, low and controlled, then the sound of footsteps moving away. The consultation room fell quiet again. Avery stood alone, staring at the scans still glowing on Kendall's phone in her memory, hearing the monitor tones from 2 different operating rooms echoing in her head. 48 hours. Avery stayed in the consult room long after Kendall's footsteps faded. The air smelled faintly of hand sanitizer and stale coffee. The mountain print on the wall looked too bright, too clean, like it belonged to a different world. She opened the door. Ross was still there, leaning against the opposite wall, arms folded. His eyes lifted the moment he saw her face. "What did she want?" he asked. Avery walked past him without answering, heading down the hall toward the staff corridor, where the noise of the hospital could swallow a conversation. Ross followed at her shoulder, quiet, patient, like he already knew the shape of what he was about to hear. When they reached an empty alcove near a supply room, Avery stopped. "Her father," she said. "Senator Halston Price. He has an aortic dissection." Ross's expression tightened. "Of course he does." "She wants me to operate," Avery said. Ross stared at her for a beat, then shook his head once. "No." Avery's gaze snapped to his. "It is not your decision." "It is a trap," Ross said, voice low. "It has his name on it and your blood on it." Avery felt something sharp twist in her chest. "You think I do not know that?" Ross leaned closer, keeping his tone controlled. "Avery, listen to me. That family destroyed you. They will do it again if you give them the chance." Avery looked away, staring at the floor tiles at the scuff marks left by 1,000 gurneys. "If I say no and he dies," she said, "I will hear that monitor tone for the rest of my life." Ross's jaw flexed. "You think saving him will make it stop?" Avery did not answer because she did not know. She only knew that something inside her refused to let a life slip away when her hands could prevent it, even if her heart hated the person attached to that life. They stood in silence until a nurse walked by, pushing a cart of linens. The nurse glanced at them, then looked away, and kept moving. Ross spoke again, softer. "If you do this, it will not be clean. There will be lawyers. There will be cameras. There will be someone ready to blame you the moment anything goes wrong." Avery swallowed. "It is a high-risk repair." Ross nodded. "The kind of case where even perfection can look like failure." Avery's fingers curled against the seam of her scrub pants. "I asked for time," she said. 48 hours. Ross exhaled. "Good. Use it." Avery left him there and walked back toward the emergency department. Her feet moved on autopilot. Her mind did not. A trauma bay curtain swayed as a resident ducked inside. A monitor beeped. Someone laughed too loudly at a joke that was not funny. The hospital kept breathing indifferent to the war happening inside her ribs. When her shift ended, Avery drove home through streets buried under snow. The city looked muffled, like someone had wrapped it in cotton. Her apartment building stood dark and quiet. She climbed the stairs, unlocked her door, and stepped into a room that smelled faintly of detergent and old books. She did not turn on the overhead light. She sat on the edge of the couch and stared at her hands. They looked ordinary in the dimness. No blood, no gloves, no instruments, just hands. Her phone buzzed once with a message from an unknown number. She did not open it. She did not need to. For years, unknown numbers had been the same. She walked to the kitchen sink and filled a glass with water, then set it down untouched. She tried to eat a piece of toast and could not swallow it. She paced. She stopped. She paced again. In her mind, she saw Noah Price on the table, saw the moment the aorta tore in, a way it should not have, saw the way the room had gone frantic and then suddenly quiet. She heard the senator's voice on television. She saw her own face on the screen, frozen in a photo that made her look cold, guilty, inhuman. Then she saw Kendall's face in the consult room. Not the polished smile, but the crack underneath it. The fear. Avery pressed her palms to her eyes until she saw stars. By morning, the storm had softened, but not lifted. The roads were still clogged. The news app on her phone showed a traffic map that looked like spilled ink. She went to the hospital early anyway. Not because she had to, because staying home was worse. In the staff lounge, Ross sat alone with a cup of coffee, untouched, like he had been holding it as an excuse to sit still. His eyes rose when she entered. "You sleep?" he asked. Avery shook her head. "Not really." Ross studied her for a moment. "You do not have to prove anything to anyone." Avery let out a slow breath. "This is not about proving." Ross nodded as if he understood. He gestured to the chair across from him. Avery sat hands clasped, shoulders tight. Ross spoke quietly. If you say yes, you need control. Avery's eyes narrowed. Control is a fantasy. Ross held her gaze. Then we get as close as we can. Paperwork, documentation, witnesses. We keep the truth attached to the case so no one can separate it later. Avery stared at the tabletop. They can always separate it. Ross leaned forward slightly. Not if we make it too expensive. Avery looked up surprised at the steel in his voice. Ross continued, if you do this, you do it here, in my hospital, with my team. I want camera logs, machine logs, a second attending present. I want the whole room stacked with people who can testify to what happened. Avery's throat tightened. You would do that for me. Ross did not flinch. I am already doing it. Avery held his gaze. The ally she had never allowed herself to want sat across from her, tired and stubborn and still willing. She reached into her pocket and pulled out her phone. Ross watched without speaking as she scrolled to Kendall's contact, a number Kendall had texted to her late the night before. Avery stared at it for a long moment, thumb hovering. Then she pressed call. It rang twice. Kendall answered voice-clipped alert. Yes. Avery kept her tone steady. I will do it. But I have conditions. There was a beat of silence, then Kendall's breathing shifted, relief leaking through control. Name them. Avery's voice stayed flat, precise. Your father signs a waiver. Full. No liability. No civil action. No public statements that imply wrongdoing, no matter the outcome. Kendall said nothing, listening. Avery continued. The surgery happens at Mile High Regional. Dr. Ross assists. Not optional. Kendall's voice tightened. My father has his own surgeon. Avery cut in. Then he can die with his own surgeon. I am not walking into this alone. Silence again, sharper this time. Avery added, every step is documented. We record the procedure. We keep equipment logs. We keep the chain of custody on supplies. If anything is questioned, it is questioned with evidence, not noise. Kendall inhaled slowly, and after, Avery's jaw tightened. After it is done, your family never contacts me again. Not for favors, not for interviews, not for apologies. Nothing. Kendall's voice softened. Avery. Avery's tone stayed cold. Madeline is not available. Another pause. Then Kendall spoke, and when she did, her composure sounded strained by something real. Agreed. I will have the paperwork ready tonight. Avery ended the call and stared at the blank screen. Ross was watching her carefully. She agreed. Avery nodded once. Ross exhaled, then rubbed his left hand over his face, as if he could wipe off exhaustion. His right hand stayed still on the table, but Avery saw the effort behind it. Security will be a mess, Ross said. Lawyers will be a mess. Avery stared at her coffee still untouched. Let them be a mess. Ross leaned back. Administration will try to stop you. Avery looked up. Why? Ross's mouth tightened. Because hospitals do not like attention they cannot control. He was right. By afternoon, Avery saw it unfold. A woman from hospital communications cornered Ross outside the surgical suite. She wore a blazer that looked too crisp for a snowstorm and held a tablet like a weapon. Ethan, we cannot have an uncredentialed individual involved in a high-profile case, she said. Voice bright, rehearsed. Ross stayed calm. She is credentialed for emergency assist. This is not an emergency assist. The woman snapped, then softened her tone as if she remembered people could hear her. This is the senator. This becomes national news the second his name hits the schedule. Avery stood a few feet away, silent, watching Ross hold his ground. Ross replied, then we do it right. That is the whole point. The woman's eyes flicked to Avery. They were not cruel. They were calculating. And if something goes wrong, Avery felt heat rise under her skin. She wanted to say, something always goes wrong. That is why surgeons exist. She kept her mouth shut. Ross answered instead. If something goes wrong, it goes wrong on record with witnesses, with documentation, not in whispers. The woman pressed her lips together. Legal will want to review everything. Ross nodded. They can review it while we save his life. Later, in a small conference room, hospital counsel slid a thick waiver across the table. The pages smelled like fresh toner. Kendall sat on the other side posture, straight hair, perfect eyes, tired. Two men in suits sat beside her, faces unreadable. Avery read every line, twice. Kendall watched her with a mix of impatience and respect. Is it acceptable? Avery looked up. Add a clause that prevents your family from releasing selective information to the press. One of the lawyers started to object. Kendall lifted a hand. Do it, Kendall said. Avery watched the lawyer's pen scratch across paper. It felt strange sitting at a table with the Price name on the document watching them bend. When Avery finally signed, she felt nothing like victory. Only a deeper awareness that she had stepped into a room that could turn on her at any second. That night, close to midnight, the senator arrived. The hallway outside the private unit filled with men in dark coats and earpieces. Security badges flashed. A nurse tried to pass and was stopped, questioned, waved through, only after showing her ID twice. Avery walked toward the unit with Ross beside her. She kept her face blank, her shoulders loose, her breathing steady. Kendall met them at the door. Under the bright lights, her skin looked pale. She nodded once to Avery, then to Ross. He is awake, Kendall said. He asked for you. Avery's stomach tightened. He knows. Kendall's eyes flicked away for half a second. He knows enough. They entered. Senator Halston Price lay in a private room that looked more like a hotel suite than a hospital. The monitors were the same, though. The beeps did not care about money. He turned his head when Avery walked in. His face was thinner than the image Avery carried from television. His eyes were wet, not with sentiment, but with pain and fear he could no longer manage. Dr. Keats, he said, voice hoarse. Avery stopped near the foot of the bed. She did not step closer. He swallowed. My daughter told me you agreed. Avery's gaze went to the screen displaying his imaging. The dissection was broad, ugly, unstable. It looked like the kind of tear that could become a rupture with one wrong breath. She kept her voice clinical. Your case is high risk. I know, he said. His eyes held hers, and for a moment, Avery saw not the man at the podium, but a patient trapped inside his own body. Why are you doing this? Avery felt her jaw tighten. She did not answer the question the way he wanted. She pointed to the screen instead, tracing the line with a gloved finger she had pulled on before entering. This portion is fragile, she said. If it ruptures, you will bleed out before anyone can reach an instrument. He nodded slowly, swallowing fear like medicine. I understand. Avery turned to leave. Behind her, he spoke again, quieter. I am sorry. The words hit her back like a hand trying to pull her into the past. She kept walking. Outside the room, Ross waited until the door closed before speaking. How are you holding up? Avery's voice stayed flat. I am holding up. Ross watched her for a beat, then nodded. We go step by step. As they walked down the hallway toward the elevators, Avery noticed something small that made her skin prickle. A security guard was stationed by a service door, not facing the corridor, facing the door itself. His stance was wrong, tense, like he was expecting someone to come through. Avery kept moving. At the corner, Kendall stopped hand on her phone. I need to handle something, she said to Ross. Ross nodded and continued with Avery. They reached the elevators. The doors opened. They stepped inside. Just before the doors slid shut, a man in a dark suit appeared at the end of the hall, walking fast. He held a phone to his ear, speaking in a low voice that carried just enough to snag Avery's attention. She heard two words through the narrowing gap of the closing doors. Keats is here. The elevator doors slid shut, sealing Avery and Ross inside a box of polished steel and soft fluorescent light. For a moment, neither of them spoke. The building creaked around them, a living thing, settling under the weight of snow. Ross stared at the numbers above the door as the elevator rose. Avery kept her eyes on the seam where the doors met, as if she could still see the hallway through the crack. Did you hear that? She asked. Ross's jaw tightened. I heard enough. Avery's fingers flexed once, then stilled. He said my name like it was a signal. Ross nodded slow. Which means someone is making calls. The elevator dinged. The doors opened onto the surgical floor, quieter than the emergency department, but never truly calm. A nurse moved past with a chart folder hugged tight to her chest. A respiratory therapist rolled a cart with oxygen tanks that clinked softly with each bump. Ross stepped out first. Avery followed. "Cancel it," Ross said under his breath, the words clipped. "We can call it a safety delay. We can say he is unstable. We can blame the storm." Avery kept walking. "If we cancel the story, starts without us." Ross caught up to her. "The story starts either way." Avery stopped at a window overlooking the courtyard. Snow drifted in slow spirals under the floodlights. The world outside looked clean and silent. Inside, everything was noise and consequence. "If he dies without surgery," Avery said, "they can say I refused. They can say I came back for revenge." Ross's eyes narrowed. "And if something goes wrong in there, they can say you killed him." Avery swallowed. "I know." Ross's right hand twitched once at his side. He curled it into a fist, then opened it again. "We can reduce the risk," he said. "Not the medical risk. The other kind." Avery turned her head. "How?" Ross gestured down the corridor. "We build a wall of facts. We make it hard to lie." They moved into the surgeon's lounge and shut the door. The room smelled of burnt coffee and hand soap. A television mounted on the wall played a muted weather report. The caption crawl showed highway closures and school cancellations. Ross crossed to a table and opened a notebook. He wrote quickly neat block letters, then slid the page toward Avery. "Two attendings," he said. "Me and one more. I already called Dr. Priya Nair from Vascular. She is stuck here because of the storm. She agreed to observe and sign off on the intraoperative record." Avery's eyebrows lifted. "She will not like this." "She does not have to like it," Ross said. "She has to witness it." Ross continued counting on his fingers. 2 residents. 1 perfusionist. 1 backup perfusionist on site. Cardiac anesthesia not floating coverage. "And we lock down the room." Avery stared at him. "Lock down." Ross nodded. "No visitors. No staff changes without a log. No one walks in with a phone out. No one touches equipment without being seen." Avery felt her pulse steady, not calm, but focused. "They can still tamper." Ross's gaze held hers. "Then we make tampering loud." He grabbed his phone and dialed. Avery heard a soft ring, then a voice. "This is Ross," he said. "I need security on OR3. Full access control. I want a guard at the door from setup through closure. I want badge scans for every entry. I want the camera feed preserved. Not for 30 days. Indefinitely. Yes, I will sign the request." He ended the call and immediately dialed another number. "Biomed," he said when someone answered. "I need a full equipment check on OR3 now. Bypass console, heater cooler, suction cautery lights. Everything. I want a written report. I want a technician assigned to remain on standby during the case." He hung up and looked at Avery. "We are going to be annoying," he said. "We are going to be a problem." Avery let out a breath that was almost a laugh. "Good." Ross reached for a stack of forms and started filling them out. His left hand moved fast. His right hand stayed close, steady enough to hold paper, but not steady enough to be ignored. Avery watched him for a moment, then looked away. She did not want him to see pity in her face. A knock came at the door. Ross opened it. Kendall stood there, coat still on hair, perfect eyes, sharp with sleeplessness. She stepped inside and shut the door behind her. "You called security," she said. Ross did not blink. "Yes." Kendall's gaze flicked to Avery. "Is this necessary?" Avery answered before Ross could. "Yes." Kendall's mouth tightened. "My father is already surrounded by security." Avery's voice stayed flat. "Not the kind that matters." Kendall stared at her for a beat, then looked away, as if she did not like the feeling of being outmaneuvered. "Fine," she said. "Do what you need." Ross tapped the papers. "I need your legal team to sign an addendum. No press activity in this hospital without clearance from administration. No statements about the surgery while he is in the operating room. No selective leaks." Kendall's eyes narrowed. "My team will not leak." Avery watched Kendall's face. A brief hesitation crossed it, almost invisible. Ross noticed too. "Then you should have no problem signing." Kendall held Ross's gaze a moment longer, then nodded. "Send it." Ross handed her the paper. Kendall skimmed, then signed with a quick stroke that looked more like an act of defiance than agreement. Avery spoke softly. Who was that man in the hall? Kendall's shoulders stiffened. What man? Avery's eyes did not leave her. The one on the phone. Kendall's lips parted, then closed. People are worried. My father is a public figure. Avery felt a cold thread move through her ribs. Worried about his health. Kendall's eyes flashed, worried about everything. Ross stepped between them with his voice calm and firm. Kendall, no one touches this room except staff who are logged and verified. If your people want updates, they will get them after the surgery. Kendall's jaw tightened. You are acting like we are the enemy. Avery did not raise her voice. I am acting like someone wants a story. I am acting like I refuse to be the story. Kendall looked at Avery for a long moment. Something shifted in her expression, a flicker of understanding she did not seem to want to admit. Do your safeguards, Kendall said quietly. Just save him. She turned and walked out. When the door shut, Ross exhaled. She is holding something back. Avery nodded once. So is everyone. The night moved forward in a series of tasks that felt like building a fortress out of paper and procedure. Avery met with Dr. Nair in the vascular office. Nair was shorter than Avery expected, hair tucked tight under a cap, even off-shift eyes that missed nothing. I do not like politics in my operating rooms, Nair said. Avery replied, neither do I. Nair studied her, then nodded toward the badge on Avery's scrubs. You are not credentialed for this. I am credentialed for emergency assist, Avery said. And I am the one doing the repair. Nair's gaze sharpened. So it is true. Avery did not answer. She did not confirm or deny. She only held Nair's eyes until the other woman looked away first. Nair tapped a pen against her desk. I will observe. I will sign what I see. If anyone tries to rewrite the truth later, they will have to rewrite me too. Avery felt a small knot loosen in her chest. Thank you. Nair shrugged. Do not thank me. Do the job. In the operating suite, Biomed arrived with a rolling cart of tools and test equipment. A technician ran checks on the bypass console and the heater cooler. Another tech tested the suction units, the cautery, the overhead lights. They printed reports and handed them to Ross, who signed and copied them. Avery walked the room slowly, eyes scanning the corners, the shelves, the carts. She checked seals on medication drawers. She checked the instrument trays. She watched people's hands. Near the sink area, she saw the circulating nurse from Liam Mercer's case, the woman with the hidden badge. This time, her badge was visible. The name read, Tessa Lane. Tessa moved with practiced confidence, answering questions before they were asked, smiling at staff, touching the right things at the right times. Avery watched her for a moment. Tessa glanced up and caught Avery looking. Her smile stayed in place, but her eyes chilled. You need anything? Tessa asked. Avery held her gaze. Just the truth. Tessa blinked once. Then you are in the wrong building. She turned away and continued prepping her movements smooth. Avery walked to Ross. That nurse, she said quietly. Tessa Lane. She was here for Liam's case. Ross looked toward Tessa, then back to Avery. She is on the schedule. Avery's voice stayed low. I do not want her. Ross's eyebrows lifted. Why? Avery searched for a clean reason. She did not have one. She had a feeling sharp and specific, the kind she trusted in an operating room. She watches too much, Avery said. Ross's jaw tightened. He nodded once and moved immediately toward the charge desk. Avery saw him speak to the charge nurse, saw the exchange of clipped sentences and tight nods. Minutes later, Tessa was told she had been reassigned. Tessa's smile did not falter. She simply nodded, unhooked her badge, and walked away without complaint. Avery watched her go, the back of her head disappearing around a corner. It did not make Avery feel better. At 4 a.m, Avery stood outside the senator's room, chart in hand, listening to the steady beep of a monitor through the door. She told herself she was reviewing scans one last time. She told herself she was keeping the case in her head where she could control it. Voices drifted from inside. Kendall's voice tight. You cannot do this. A man's voice answered, calm and annoyed. It is already done. Avery froze. Kendall spoke again, lower now. Not now. Not while he is about to have surgery. The election is in 3 weeks, the man said. If he dies on the table, the party needs continuity. You step in. The narrative writes itself. Kendall's breath hitched. You are talking about my father like he is a headline. He is a headline, the man replied. He is also a liability. He has been soft lately, talking about stepping away, talking about making amends. That cannot happen. Kendall's voice rose, then snapped back into control. Get out! Avery felt her blood turn cold. The man's tone sharpened. You want to protect him, then you do what you are told. The press release is ready. The campaign materials are ready. All we need is for the surgery to about fail. Avery's stomach clenched. Footsteps moved toward the door. Avery stepped backward into a supply alcove just as the door opened. A man in a dark suit walked out, phone already in his hand. He did not look around. He did not need to. He moved like someone who believed the world belonged to him. As he passed, his voice dropped into the phone again. Yes. Keats is confirmed. She is in the building. If anything happens, the blame goes where it belongs. He turned the corner and vanished. Avery stayed pressed against the shelf, heart hammering, breath shallow. She could hear Kendall inside the room, a sharp inhale, then the softer sound of someone trying not to cry. Avery forced herself to move. She walked fast, quiet, straight to the surgeon's lounge. Ross was there already in scrubs, reading the operative plan like it was scripture. He looked up the instant she entered. What he said, and it was not a question, it was a warning. Avery shut the door behind her. I heard Kendall arguing with someone in her father's room, a man in a suit. He said they have campaign materials prepared. He said they need the surgery to fail. Ross's face went still. Avery continued, voice controlled, each word placed like a stitch. He said, if anything happens, the blame goes on me. Ross's right hand trembled, then stilled as he pressed it flat against the table. We cancel, he said. Avery shook her head. If we cancel now, they control the story. They say I refused. They say I panicked. They say I came back to punish him. Ross's eyes flashed. And if you operate, they try to make you the villain anyway. Avery stared at him. Then we make it harder. Ross stood. He stepped close, grip firm, but careful on her shoulders, forcing her to meet his eyes. You do not touch a single instrument that is not accounted for, he said. You do not let anyone rush you. If something looks wrong, we stop. We replace. We document. We call Biomed back in the room if we need to. Avery nodded once. And we keep witnesses. Ross's jaw clenched. We keep witnesses. Avery took a breath. Kendall may not be in on it. Ross's eyes narrowed. But someone around her is. They moved together down the hall, their steps matched. Security was already outside, or 3. A guard checked their badges and logged their entry time. Inside, the team waited. Dr. Nair stood near the anesthesia, sidearms folded, eyes sharp. The perfusionist ran through the bypass checklist. The scrub tech laid instruments with careful precision. Avery stepped to the bypass console and watched the perfusionist's hands. She scanned the machine, the tubing, the screen. Everything looked normal, which did not comfort her at all. At 5:30, the doors opened and the senator was rolled in under warm blankets, skin-pale eyes open. His gaze found Avery immediately. He tried to speak. His voice cracked. Dr. Keats. Avery did not answer. She moved to the head of the bed and checked his face, his breathing, his hands. She saw fear there, real and unprotected. An anesthesiologist leaned close. We are ready when you are. Avery nodded. She watched the medications flow, watched the senator's eyes grow heavy, watched his grip loosen. As the team began prepping, Ross leaned in close enough that only Avery could hear. We do it clean, he said. Avery's voice stayed quiet. We do it with receipts. She stepped to the scrub sink and washed methodical slow. The ritual steadied her. She dried gloved and entered the room again. The patient was draped. The lights blazed overhead. The world narrowed to a field of blue. Avery walked to the perfusion console one more time and looked at the screen. A tiny red indicator in the corner glowed, almost hidden against the interface. Service mode cleared at 5:27. Avery's stomach tightened. She looked at the machine again, closer, as if her eyes could force it to confess. Then she turned her head and met Ross's gaze across the table. Avery held Ross's gaze across the table and gave him the smallest nod. Ross understood. He did not ask questions. He turned to the perfusionist and spoke in a steady voice that carried authority without raising volume. "Hold, we are pausing for a safety check." The room froze in place. Not panic, not argument, just a sudden stillness that made every beep feel louder. The perfusionist's hands hovered over the console. "We are not on bypass yet," Good Ross said. "Keep it that way." Avery stepped closer to the console and pointed at the red indicator. Service mode cleared at 5:27. Who accessed it? The perfusionist frowned and leaned in. No one should have. Dr. Nair moved to Avery's side, eyes sharp. That is not a normal flag. Avery felt her pulse hammer once, then settle into focus. "Call Biomed back in. Now." Ross turned to the circulating nurse. "Page Biomed to OR3 and document the time. Also document this indicator on the record." The circulating nurse nodded and moved fast hands already on the phone. Avery looked at the bypass tubing, at the clamps, at the connections that could turn a live case into a disaster in seconds. She did not touch anything yet. She watched. She waited for someone else's hands to be present as a witness. The door opened and a technician hurried in, breath visible from the cold corridor outside. "What's going on?" the technician asked. Avery pointed. "That." The technician leaned over the console, fingers moving across menus. "That log shows a reset. Someone entered service mode and cleared it." Ross's voice stayed even. "Could it be a false flag?" The technician shook his head. "It should not happen without a code." Dr. Nair folded her arms. "Then treat it as tampering until proven otherwise." Avery felt a grim relief, not because she wanted to be right, but because she wanted the truth to have witnesses. She watched the technician check the settings, then the alarms, then the software log. "There," the technician said. "Alarm delay on arterial pressure is longer than default." Avery's stomach tightened. "Change it back." The technician did. "Done. I am logging the changes." Avery kept her voice calm. "Print it. Sign it. Leave a copy with Dr. Ross." The technician nodded, moved to the printer port, then paused. This could still be accidental. Avery looked at him. "Accidents do not require service codes." The technician swallowed and kept working. Ross stepped closer to Avery, voice low. "We can still stop." Avery's eyes stayed on the sterile field. "If we stop now, it will look like fear. We continue, but we watch everything. We do not let the machine lie." Dr. Nair's gaze flicked between them. "I will watch too." The technician handed Ross a printed report with a signature line. Ross signed. Dr. Nair signed. The technician signed. The paper went into a clear sleeve and onto a clipboard at the anesthesia station. Avery turned back to the table. The senator lay draped and silent, skin pale, under bright lights, chest rising with the ventilator. For a moment, she saw the man on television, then she forced that image away until all she saw was anatomy and time. "Time out again," Ross said. The circulating nurse repeated the procedure details. The team confirmed. Dr. Nair stated her role as observer. Ross stated his as assisting attending. Avery stated hers as surgical lead. Avery met Ross's eyes once more. "We go slow where it matters." Ross nodded. "We go slow where it matters." Incision, Avery said. The scalpel slid through skin with clean certainty. The sternum saw followed its whine steady. The chest opened, ribs spread, and the field revealed itself. The aorta was worse than the scan. The wall looked bruised, stretched, ready to fail. Avery felt the old familiar chill in her fingertips. This tissue did not forgive. "Cooling now," she said. The perfusionist responded immediately. Cooling initiated. Ross placed retractors with his left hand, careful and controlled. His right hand stayed close, used only when necessary. Avery noticed the tension in his shoulders, the concentration it took to keep the tremor from entering the work. They cannulated. They initiated bypass. The heart quieted under the machine's rhythm. The room settled into the focused hush that only existed inside an operating theater. Avery's voice stayed low and precise. "Clamp here. Not there." The wall is thinner on the anterior curve. Ross adjusted the clamp carefully, like this. Yes, Avery said. Hold it. Do not chase the tissue. Dr. Nair stood near the head eyes, tracking each movement silent as a camera. Avery opened the aorta. Even with bypass and clamps, there was blood. There was always blood. But it stayed controlled, manageable. Avery worked quickly, cutting out the worst of the damaged segment, exposing the true lumen, protecting the branch vessels. Graft, she said. The scrub tech placed it in her hand. Avery laid it along the defect, measured, trimmed. She began the proximal anastomosis needle in and out, rhythm steady. Ross held retraction. Your bites are smaller than mine, he murmured. They have to be, Avery replied. This wall will tear if we bully it. Ross nodded and she felt him lock into her rhythm. The first suture line held. Avery moved to the distal end. The dissection extended lower than she wanted. It was cruel how the body could hide damage until the moment you needed honesty most. Second graft ready, she said. The scrub tech nodded. Ready. Avery attached the second graft, making a bridge of clean synthetic material where the vessel had become unreliable. She kept her voice calm, but inside her mind was counting. Always counting, tracking minutes of cooling, minutes of arrest, minutes of safe work before the body demanded speed. Rewarming in 10, she told perfusion. Copy, the perfusionist said. Avery was halfway through the distal suture line when the anesthesiologist's voice cut through the room, sharp. Pressure is dropping. Avery did not look up. On bypass. Yes, the anesthesiologist replied. It is dropping too fast. This does not match our flow. The perfusionist glanced at the screen. Flow is stable. Venous return is good. Avery felt a cold bead of dread form at the base of her skull. When numbers dropped without an obvious reason, it meant the reason was hidden. Check the field, she said. The resident adjusted suction. The field looked clean. No obvious bleeding. No spray. No pooling where it should not be. Pressure is 60, the anesthesiologist said. 58. Avery's voice tightened. Give volume. Increase flow. Perfusion adjusted. The numbers barely budged. Avery paused her suturing. She scanned every corner of the field, every connection, every clamp. The graft line was intact. The stitches were holding. There was no leak where she could see. Her chest tightened. Suction deeper. I need to see behind the heart. Ross leaned in, moving the retractor with careful force. Here. Avery angled the light. The tissue shimmered wetly. Still no obvious source. Pressure is 50, the anesthesiologist warned. We have minutes. Avery heard her own heartbeat, a heavy drum. She forced it down. There was always a reason. The body did not lie. People did. Machines did. Tissue did not. She looked again, not at the obvious. She looked at the places that hid. Lift, she said. Ross adjusted. The resident suctioned. Avery's eyes caught a thin, dark line where it did not belong, a shadow behind the grafted segment. There. Stop, she said. She reached in carefully, fingertips exploring behind the graft. Warm blood welled where her fingers touched. Not from the field she had been watching, but from behind it. A second tear, she said, voice quiet. Hidden dissection behind the first. Dr. Nair's voice broke her silence. Do you see rupture? Avery did not answer. She placed suction and watched. Blood surged from the hidden space, pouring into the chest cavity. Yes, Avery said. It is ruptured. The room snapped into controlled chaos. Blood, Avery said. Now. The anesthesiologist spoke fast. Call massive transfusion. O negative. 6 units. The circulating nurse moved. On it. Avery felt the tissue with her fingertips. It was fragile, worse than paper. Each time she tried to clamp the edge, it tore a little more like wet tissue under tension. Ross leaned in, trying to help. His left hand held his right hand, hovering, desperate. It is shredding, Ross said. I know, Avery replied. Pressure 45, the anesthesiologist said. We are losing him. Avery's mind ran through standard options and discarded them one by one. Standard clamps would tear. Standard sutures would cut through. Standard patches would not seal against this kind of damage. She needed something that could distribute force, reinforce without slicing, create a new wall where the old wall refused to exist. A phrase flashed in her mind, a journal article she had read late at night years ago, a technique described as experimental, risky, and rarely attempted in live disaster settings. She had never done it. Her hands did not care. Her hands remembered how to try. "I am going to do a sidewall reinforcement patch," she said. The resident blinked. "What is that?" Dr. Nayer's eyes sharpened. "That is not standard." Ross did not hesitate. "Do it." Avery looked at him. "I need you steady." Ross's jaw tightened. He forced his right hand down against the retractor handle and kept his left hand as the working anchor. "I am steady." Avery turned to the scrub tech. "I need a patch." "The widest we have." Felt reinforced. The scrub tech moved fast. "Patch coming." Avery pressed her fingers into the bleeding space, controlling flow as best she could. Her glove filled with warm blood. She felt the vessel wall flutter under her touch. The patch landed in her hand. Avery positioned it along the lateral curve, where the rupture had opened like a mouth. She placed it so it overlapped healthy tissue, distributing the stress. "Needle," she said. The needle driver snapped into her palm. Avery began suturing, not in a tight, aggressive line, but in a broad pattern that spread the load. She took small bites of tissue, then anchored into stronger areas, using the patch as a new scaffold. The bleeding slowed, then surged again when the tissue threatened to tear. "Hold the field," she said. The resident suctioned with both hands. Ross adjusted exposure. Dr. Nayer leaned in, watching the pattern eyes tracking each placement. Avery's mind narrowed to one thing. Each stitch had to land clean. Not too deep, not too shallow, not too close, not too far. Every error here would be irreversible. "Pressure 40, the anesthesiologist said, voice tight. 38. Avery kept moving. Needle in, out, tie, again. Her shoulders burned. Her forearms ached. Her fingers stayed precise. She finished the line and pressed the patch gently, letting it settle into place. Blood continued to ooze, but it was no longer a flood. "Give it a second," she said. The anesthesiologist watched the monitor. "Pressure is rising. 45, 52. The perfusionist's voice came hopeful. "Flow is stable. Return improving." Avery held her breath and watched the patch. 60, the anesthesiologist said. 70. Avery felt something unlock in her chest. Not relief, not celebration, just the permission to breathe again. 90, the anesthesiologist said. "Stabilizing." Avery nodded once. "Secure the edge." She placed reinforcing stitches, careful, methodical, ensuring the patch would not peel. Ross held the field steady. His breathing controlled his tremor, contained by sheer will. The crisis passed in inches, not miles. Avery returned to the graft line and finished the final sutures. She checked every seam. No leak, no seep, nothing that would betray them later. "Rewarm," she said again, voice calmer now. The perfusionist complied. The body warmed. The heart resumed its work. The rhythm returned. When they weaned from bypass, the numbers held. The senator's pressure stayed strong. His oxygenation stabilized. His blood gases normalized. "Stable." The anesthesiologist said, voice softer. "He is stable." Avery stepped back, eyes still on the field. She waited, counting seconds, watching for the late bleed that could punish a surgeon for trusting too soon. Nothing happened. She nodded to the residents. Close. The closure took time, layer by layer, as if the body needed to be persuaded to accept what had been done to it. Wires, fascia, skin, dressings. The final instrument count was called out. Correct. Verified. Avery removed her gloves slowly. Her fingers were pale where the latex had pressed them. She flexed them once, testing for tremor. They stayed steady. Ross stood near the sink, shoulders slumped just a little now, that he no longer had to be unbreakable. Dr. Nayer wrote notes, her pen moving in quick, decisive strokes, signing off on the critical events and the equipment logs. Avery looked at the clock. A little after 9. She turned toward the door, ready to leave the room before her legs remembered how to shake. Then she saw Ross's expression change. He was not looking at her. He was looking past her toward the doorway. Avery followed his gaze. Kendall Price stood there, eyes red, one hand pressed to her mouth as if she had been holding back sound. Relief trembled through her posture. but she was not alone. Two police officers stood behind her, faces neutral, hands resting near their belts. Their attention was not on Kendall. It was on Avery. Avery's skin went cold. One of the officers stepped forward and spoke clearly as if announcing a name on a list. Dr. Madeline Keats. Avery did not answer at first. She felt the room tilt, the same subtle shift she had felt in Ross's office in the consult room. In every moment, the past tried to climb into the present. Ross moved a half step toward her, but Avery lifted a hand, stopping him without looking. "Yes," she said. "We need you to come with us," the officer said. "There are questions regarding a surgery performed 5 years ago." Avery did not move until the officer repeated her name. The operating room still smelled of cautery and warm plastic. The monitors had settled into a steady rhythm behind her, as if nothing in the world had changed. Ross stepped forward. "She is not going anywhere without counsel," he said. His voice was calm, but there was steel under it. "And she is not answering questions in a hallway." The younger officer glanced at his partner. "Doctor, she is not under arrest. We are requesting she come in voluntarily." Ross did not blink. "Then you can request it after her lawyer arrives." The older officer's tone stayed neutral. "We can do this here, or we can do it downtown. Either way, we need to speak with her." Kendall stood just inside the doorway, eyes, glossy mouth, tight. She looked at Avery like she wanted to say something and could not find words that would not break. Avery wiped her hands on a towel that was already clean. Her fingers felt numb, like the nerves had stepped away to avoid the moment. She turned and looked at the patient one last time. Senator Price lay covered and bandaged alive. The work had been real. The trap could be real too. "I'll go," Avery said. Ross's head snapped toward her. "No." Avery met his eyes. "If I refuse, it becomes a headline. If I walk, it becomes paperwork." Ross's jaw tightened, but he nodded once. "Then I am coming." The younger officer started to object. Ross cut him off. "I am coming, and we are calling legal. Now." They walked out of the operating suite into a corridor where staff had begun to gather, drawn by the sight of uniforms near the doors. Faces turned. Whispers followed. Avery kept her posture straight, her gaze forward as if she were walking to a supply room instead of into a past that had been waiting for her. Security held the elevator for them. The ride down felt too quiet. Avery could hear the faint rasp of Ross's breathing and the soft crackle of the officer's radio. At the entrance, a cruiser waited, lights off, engine idling. Snow swirled under the street lamp like ash. "I can drive myself," Avery said. The older officer shook his head. "Standard procedure." Avery looked at Ross. He leaned in close, voice low. "Say nothing until counsel." Avery nodded. She sat in the back seat, hands folded, watching the hospital recede through a fogged window. Mile High Regional had been her shelter. Now it looked like any other building. Bright, indifferent, and sealed tight against the storm. Downtown, the station smelled of old coffee and wet wool. A uniformed desk officer took down names and guided Avery to an interview room. Gray walls, metal table, 2 chairs. A mirror that pretended to be a mirror. The door shut with a click that landed in Avery's bones. She sat and waited. Time stretched. The air felt dry and recycled. Somewhere in the building, a phone rang, then rang again. 2 detectives entered. The first was a woman in her 40s with dark hair pulled back and tired eyes that did not miss details. She carried herself like someone who had seen every kind of story and did not rush to believe any of them. The second was a man, a little younger, sharper suit jacket open, gaze quick and hungry. The woman spoke first. "Dr. Madeline Keats. I am Detective Lena Alvarez. This is Detective Grant Harper." Avery kept her hands on the table. "Am I under arrest?" Alvarez sat across from her. Harper stayed standing for a moment, leaning lightly against the wall, then sat beside Alvarez. "No," Alvarez said. "You are free to leave. But we would like to ask some questions." Avery held Alvarez's gaze. "About 5 years ago." Harper slid a folder onto the table. "About Noah Price." Avery did not reach for the folder. "I know the name." Harper opened it and pushed a photo forward. A young man with kind eyes and a bright smile. The kind of smile that belonged in graduation pictures and holiday cards. Avery stared at it for a beat too long. Her throat tightened. "Do you recognize him?" Harper asked. Avery's voice stayed flat. "Not personally." "You operated on him," Harper said. "I did," Avery replied. Alvarez's tone softened slightly. "We reviewed the public record. We reviewed the board findings. We know what happened after." Avery's lips pressed together. Her palms felt damp against the metal. Harper tapped the photo. "We also have new evidence." Avery looked up. "What kind of evidence?" Alvarez did not speak. Harper did. Evidence that Noah Price's medical file was altered before his surgery. The room went still. Avery's breath stalled. "That is impossible." Harper's eyes narrowed. "Is it?" Avery forced herself to speak evenly. "I reviewed his chart. I reviewed his imaging. I reviewed his labs. There was no indication of a connective tissue disorder, no family history, nothing." Alvarez nodded once as if she expected those exact words. "That is the point." Harper opened the folder and pulled out a few pages sealed in plastic sleeves. "This is a record audit. The chart you saw was not the chart that existed before." Avery stared. The print looked clinical, familiar, cold, the kind of paper that decided fates. Alvarez leaned forward. "Someone removed information about genetic risk, family history, notes that would have changed your preoperative assessment." Avery's heart hammered. "Who?" Harper said. "That is what we are trying to determine." Avery's voice rose a fraction before she pulled it back down. "Why are you telling me this now?" Alvarez held her gaze. "Because you may have been set up. Then and now." Avery's stomach clenched. The storm outside felt suddenly irrelevant. The weather was not what trapped her. People were. Harper's tone sharpened. "We need to know why you were working under a different name. We need to know who knew. We need to know who could benefit from blaming you again." Avery stared at the table. Her mind raced, trying to grab hold of something solid. She pictured the bypass console, the service mode log, the alarm delay. She pictured the man in the hall whispering into a phone. Avery looked back up. "I changed my name because my life became unsafe." Harper lifted a brow. "Unsafe." Avery's voice stayed quiet. "I received threats. People found my address. They followed me. I could not work. I could not sleep. I could not walk into a grocery store without someone staring like they wanted to spit." Alvarez watched her carefully. "Why become a nurse?" Avery swallowed. "Because I could not leave medicine. I could not be a surgeon without being hunted. Nursing let me stay close enough to breathe." Harper leaned forward. "And tonight you chose to operate again." Avery felt the anger spark. "Tonight I saved a man's life." Harper's eyes hardened. "A senator's life." Avery stared at him. "A patient." Alvarez lifted a hand, slowing the pace. "Dr. Keats, we are not here to accuse you. We are here because a family hired a private investigator, and that investigator uncovered a trail that does not match the story the public was sold." Avery's voice went thin. "The Price family hired an investigator." Alvarez nodded. "Kendall Price did." Avery blinked. Kendall. The daughter. The woman in the hallway with a perfect coat and cracked eyes. Harper slid another paper across the table. A log showing administrative access to Noah's record the day before surgery. A separate log showing edits made under a staff credential that should not have been active at that hour. Avery stared at the print until the lines blurred. Alvarez spoke gently. "We believe someone paid for that access. We believe someone wanted a death and wanted you to carry it." Avery felt something inside her shift. Not relief, not victory. Something colder. A new shape of fear. "Can I make a call?" Avery asked. Alvarez nodded. "One call." Avery's fingers felt stiff as she picked up her phone. She dialed Ross. He answered on the first ring. "Where are you?" "At the station," Avery said. "They say Noah's record was altered. They say someone paid to remove genetic history." Silence then, Ross's voice lower. "I need to tell you something." Avery's chest tightened. "Tell me." "When I dug into your case, Ross said I found a note buried in a legal archive. 3 weeks before Noah's surgery, Senator Price was being blackmailed. Avery closed her eyes. Blackmailed for what? For the family condition, Ross said. Someone threatened to expose it unless they paid. The amount was $2 million. Avery's throat went dry. You think someone forced the chart edits? I think someone wanted to control what the senator did next, Ross said. And I think someone wanted you destroyed. Avery opened her eyes. The mirror on the wall reflected her face back at her, pale and still. Ross continued, Do not answer questions without counsel. I am calling legal now. Avery's voice barely worked. Ross. Someone tampered with the bypass console tonight. I know, Ross said. Security has the logs. Biomed signed off on the changes. We have documentation. Avery swallowed. They are trying again. Ross's voice hardened. Then we do not let them. The call ended. Avery lowered the phone. Alvarez watched her. Dr. Ross. Avery nodded. Harper's eyes narrowed. He is involved. He assisted, Avery said. He documented. He signed. So did Vascular. Harper's mouth tightened. Good. More names. The door opened. Kendall Price stepped in with a man in a suit beside her. He carried a leather folder and moved like someone who knew exactly which rooms belonged to him. Alvarez rose slightly in her chair. Ms. Price. Kendall's eyes landed on Avery. They were red-rimmed, but steady. She saved my father, Kendall said. And you brought her here like she is a suspect. Harper's tone stayed cool. We brought her here because new evidence reopened a case. Kendall's jaw tightened. Then talk about the evidence. Talk about who paid for it. Alvarez gestured to the chair. Sit, Ms. Price. Kendall sat beside Avery, close enough that Avery could feel her body heat. The lawyer placed his folder on the table and opened it with careful precision. My name is Daniel Rusk, he said. I represent Ms. Price and Senator Price. Harper leaned forward. Then you are aware this is an active investigation. Rusk nodded. Which is why we are here. We have information. We want it on record. Avery stared at Kendall. You knew. Kendall swallowed. I did not know until tonight. Avery's voice went low. Who was the man in my father's room? Kendall's eyes flicked away, then returned. Victor Sloan, she said. My father's campaign manager. The name hit Avery like a door slamming. The man in the hall. The phone call. Keats is confirmed. Harper's eyes sharpened. Victor Sloan. Kendall nodded once. He has been with my father for years. He controls access. He controls messaging. He controls who gets close. Alvarez watched Kendall carefully. And you believe he altered the chart? Kendall's voice tightened. I know he did. Harper's posture shifted. You know, Kendall reached into her bag and pulled out a small flash drive. Her fingers trembled slightly as she set it on the table. Bank transfers, Kendall said. Emails. Recordings. Payment routing through a consulting shell. The person who accessed Noah's chart was paid. The payment trail leads to Sloan. Rusk slid a printed summary across the table. We have copies of everything. This drive contains the originals. Alvarez picked up the drive but did not plug it in. How did you get this? Kendall's eyes glistened, anger and shame mixing. Because my father is trying to tell the truth. Sloan did not want him to. Tonight I heard him say he needed the surgery to fail. Avery's pulse hammered again. So it was not paranoia. Kendall looked at Avery. No. Harper leaned forward. Did Sloan tamper with equipment? Kendall's lips pressed together. I cannot prove he touched anything with his hands. I can prove he paid people to do things 5 years ago. I can prove he is trying to control what happens now. Alvarez held Kendall's gaze. This is serious. Kendall nodded. I know. Rusk added, if you arrest Dr. Keats while Sloan walks free, you are doing his work for him. Harper's jaw clenched. Alvarez stood flash drive in hand. We will review this immediately. She looked at Avery. You are still not under arrest. You are here while we verify facts. Do you understand? Avery's voice came out steady by force. I understand. Alvarez left the room with Harper and the drive. The door shut. Avery sat in the sudden quiet, hearing only the distant buzz of fluorescent lights. Kendall sat beside her, hands clasped so tightly her knuckles had gone pale. Avery spoke without looking at her. Why now? Kendall's voice cracked, then steadied. Because my father woke up and asked what happened to Noah. Not the story, the truth. He said he was tired of living inside a lie. Avery let out a slow breath. And Sloan. Kendall's jaw tightened. Sloan built his power on my brother's death. He built my father's career on anger. If my father speaks now, everything collapses. Avery stared at the table. So he tried to make the surgery fail. Kendall's eyes filled again. Yes. Avery felt a hollow ache in her chest, a place where rage had lived for years. Rage was easier than this. The door opened again. Alvarez returned alone. Her face was controlled, but her eyes carried a new weight. Harper remained outside, speaking into a phone voice, low and urgent. Alvarez closed the door and looked at the three of them. We have enough to move on Victor Sloan, she said. Financial trail, communications, a credible motive. Kendall's shoulders sagged, relief flickering and vanishing into exhaustion. Avery's pulse eased a fraction. So it ends. Alvarez did not answer that. She leaned forward slightly, voice quiet. We are getting a warrant. But there is a problem. Avery held her gaze. What problem? Alvarez's eyes stayed on Avery's face. Sloan is not the top of this. Avery stared at Detective Alvarez, waiting for the rest of the sentence to land. Alvarez kept her voice low. Sloan is the visible hand. He is not the first hand. Kendall's fingers tightened around the edge of her chair. Who is above him? Alvarez glanced toward the one-way mirror. We are still confirming. The drive has names. Not all of them are in Denver. Avery felt the room narrow. Then why tell me? Because you are in the middle of it, Alvarez said. And because you have been used as leverage before. The door opened. Harper stepped in, phone still in his hand. His jaw was tight, eyes bright with urgency. We got the judge, Harper said. Warrant is signed. Kendall rose halfway from her chair. Now. Alvarez nodded once. Now. Avery stood too, instinct pulling her upright, as if she could physically keep the truth from slipping away. Ross's words echoed in her head. Receipts, witnesses, facts that could not be rewritten. Harper looked at Avery. You are staying here until we finish the initial move. Avery held his gaze. I am not running. Alvarez's expression softened a fraction. We know. They left the room with purpose, footsteps quick in the hall. Kendall remained breathing shallow, her lawyer speaking quietly into his phone. Avery sat back down, hands flat on the table. The metal was cold against her palms. She tried to slow her breathing, but her body refused. It had been running for 5 years. It did not know how to stop. Minutes passed, then more. A clock ticked somewhere out of sight, patient and cruel. The door opened again. Ross stepped in, first coat, still dusted with snow hair, slightly disheveled eyes scanning Avery like he was making sure she was real. Behind him, an officer from the station nodded and closed the door. Ross crossed the room without hesitation. Are you okay? Avery let out a breath that sounded like a laugh and a sob at the same time, then swallowed it. I am here. Ross's right hand trembled as he reached for the chair. Then he controlled it by gripping the backrest. Legal is on the way. Hospital counsel is already calling the station every 2 minutes. Kendall's voice came tight. My father is awake. Avery's head snapped toward her, awake. Kendall nodded. They reduced sedation. He is asking questions. Real questions. Ross's gaze sharpened. About Noah. Kendall's mouth tightened. About everything. Avery felt heat rush to her face, anger and fear trying to fight for space. If he talks, Sloan loses control. Kendall's eyes flicked away, then back. That is why he did what he did. The door opened again. Alvarez returned, breath-controlled but faster than before, cheeks flushed from cold air and movement. We have him, Alvarez said. Kendall's shoulders sagged. You arrested Victor Sloan? Alvarez nodded. At his townhouse. He tried to make a call when we walked in. He did not get far. Avery felt her chest loosen only a fraction. And the equipment. Harper's voice came from the hallway, speaking to another officer. Alvarez lowered her tone. We pulled a preliminary digital log from the bypass console, she said. Someone accessed service mode. We will trace the code. We will also pull badge records and camera footage from the OR corridor. Ross spoke evenly. The feed is preserved. I filed the request. Alvarez met his eyes. Good. Kendall's lawyer cleared his throat. Is Dr. Keats free to go? Alvarez looked at Avery. Yes, for now. Avery stood legs feeling too light. Ross stepped in close, not touching her, but close enough that she could borrow his steadiness. As they walked out, Avery saw station staff glance up, then glance away. She had the old reflex to flinch, to shrink, to vanish. She forced herself to keep walking. Outside, the storm had eased into a thin, quiet snowfall. The city looked bruised and tired. Ross drove them back to the hospital without speaking, hands tight on the wheel. When they reached Mile High, regional security was heavier. Cameras turned, guards watched, and every badge scan seemed louder than it should have been. Kendall moved ahead with her lawyer phone pressed to her ear, speaking in clipped phrases. Ross walked with Avery toward the private unit. You do not have to see him, Ross said. Avery's eyes stayed forward. I do. Senator Price's room was guarded by two men in dark coats. Kendall spoke to them, then waved Avery and Ross through. Inside, the senator lay propped up, pale eyes rimmed with exhaustion. He looked smaller than he ever had on television. The monitors kept their steady song. He turned his head when Avery entered. His gaze caught on her and held. Dr. Keats, he said, voice rough. Avery did not correct him. She did not soften either. You are stable. He swallowed. I am alive. Ross stood near the foot of the bed, arms folded, face unreadable. The senator's eyes flicked to Ross, then back to Avery. They told me Victor Sloan was arrested. Kendall stepped forward. Dad. He lifted a hand weakly. No. Let me speak. Kendall froze her face tight, but she nodded and stepped back. The senator's gaze returned to Avery. His voice shook not with performance, but with something uglier and more honest. I ruined you. Avery felt the words hit a place inside her that had been sealed shut for years. It did not open gently. It cracked. You tried, Avery said. He winced. I did. Avery stayed still. Why? His eyes filled. He blinked hard as if he hated that weakness. Because I was grieving. Because I needed a target that was not my own blood. Because my campaign manager told me what to say and when to say it, and I let him. Kendall's breath hitched. The senator's voice turned quieter. He told me the file proved you were negligent. He told me there was no family condition. He told me the hospital was protecting you. He told me the public would demand accountability, and that I could give it to them. Avery's throat went dry. And the blackmail. The senator's eyes shifted, shame deepening. Someone threatened to expose our genetic condition. They demanded money. I was terrified. Not for my career, for my daughter, for my son, for the truth. Kendall stepped closer, stunned. You never told me. He looked at her like she was the only thing in the room that mattered. I was trying to protect you, and I did the opposite. Avery watched him, seeing the man who had once stood under bright lights and used grief like a weapon, now reduced to a patient with stitches and fear. Victor did not protect you, Avery said. He used you. The senator nodded, tears slipping despite his effort. Yes. Ross spoke for the first time, voice controlled. Then tell the truth publicly. The senator's jaw trembled. I will. Kendall's eyes widened. Dad, your seat. He looked at her, exhausted and calm in a way that scared her. I do not care about my seat anymore. Avery felt a strange emptiness where she had expected satisfaction. She had imagined this moment 1,000 times, and none of those fantasies had included a sick man trying to be honest. Do it soon, Avery said, before someone else writes the story. He nodded. Tomorrow. Kendall turned away, wiping her face with the heel of her hand. Her voice came strained. I will handle the logistics. She left the room with her lawyer phone already at her ear again. Avery stepped toward the door. The senator spoke once more. Why did you save me? He asked. Avery paused, hand on the handle. She did not look back when she answered. Because you were on the table. That is all. Ross followed Avery out into the corridor. The lights felt too bright. The air felt too clean. Ross exhaled. You did it. Avery kept walking. We did. Ross's right hand trembled again, more visible now that the crisis had passed. He hid it by sliding his hand into his coat pocket. Avery saw it anyway. They reached the surgeon's lounge. Ross closed the door and leaned against it for a moment, eyes closed. "They will come after you," Avery said quietly. "Even if Sloan is arrested." Ross opened his eyes. "Let them. We have logs. We have witnesses. We have Dr. Nayer's signature on the record. We have biomed reports. We have preserved footage. We have chain of custody." Avery let out a slow breath. "I have not had that in a long time." Ross's expression softened. "You have it now." By mid-morning, news alerts began to flicker across phones. Security tightened again. Hospital communications staff moved like a swarm, trying to control what could not be controlled. In the afternoon, Alvarez called Ross's cell. Ross put it on speaker. "We confirmed enough," Alvarez said. "Sloan is being charged with conspiracy and evidence tampering, and we are expanding the investigation. The drive contains communications that link back to the Seattle case. We are coordinating with authorities there." Avery's chest tightened. "My case." Alvarez's voice stayed even. "Your case." Ross asked, "Are you clearing her?" Alvarez paused, then spoke carefully. "That will be a formal process, but yes. The evidence points to intentional chart alteration and manipulation around Noah Price's surgery. This is not a matter of opinion. It is a matter of records." Avery sat very still. The room seemed to hold its breath. After the call ended, Avery stared at the wall for a long moment. She expected to feel light. She did not. Ross watched her. "It is a lot." Avery's voice came quiet. "I built an entire life on being invisible." Ross nodded. "And now they can see you." Avery's mouth tightened. Visibility has teeth. That evening, Ross came to her apartment with a paper bag that smelled of fried food and warm bread. He set it on her counter without comment, then sat on the edge of her couch, like he was unsure he was welcome. Avery ate slowly. She realized her hands were no longer shaking from fatigue. They were steady because they were done running for the day. Ross looked down at his right hand, then back up. "I told the board I am stepping down as chief," he said. Avery blinked. "They let you." Ross gave a small, humorless smile. "They did not get to stop me. I took a position in surgical education, simulation lab, teaching residents, advising on complex cases." Avery studied him. "You are choosing the exit." Ross nodded. "Before my hand chooses it for me." Avery felt something tight in her chest ease. "That is a good choice." Ross raised his bottle of water, a quiet toast. "To being useful." Avery lifted hers. "To being useful." The next day, Senator Price held a press conference from his hospital room. A camera crew filled the space with cables and lights. Kendall stood off to the side, posture, rigid eyes fixed on her father. Avery watched on a muted television in the staff lounge, Ross beside her. The senator looked thinner, paler, but his voice was steady. He admitted his family had a genetic condition. He admitted he had been blackmailed. He admitted that Noah's medical record had been altered and that he had allowed his grief to become a weapon. He apologized to Dr. Madeline Keats by name, not as a performance, but as an acknowledgement that could not be unsaid. Avery felt her throat tighten as the name was spoken not with blame, but with restoration. Within days, the medical board contacted her. The paperwork moved faster than paperwork ever moved. Former colleagues sent messages that started with awkward apologies and ended with requests to meet. Recruiters called. Hospitals offered positions, titles, salaries, prestige. Avery turned her phone off and sat in silence, letting the quiet exist without fear. A week later, Kendall met her in a small coffee shop near the hospital. Kendall looked tired in a different way now, like someone who had traded denial for responsibility. "I am introducing a bill," Kendall said, stirring her coffee without drinking it. "Stronger protections for clinicians against retaliatory litigation and political pressure. Oversight on record access. Penalties for tampering." Avery studied her. "You want to change the system that protected your father." Kendall's mouth tightened. "I want to change the system that let a man like Victor steer my father at all." Avery nodded once. "Good. Kendall looked up, eyes direct. My father asked me to tell you something. Avery waited. Kendall swallowed. He said he knows forgiveness is not owed. He said he hopes you live without fear. Avery stared at her cup. Fear does not leave because someone asks it to. Kendall nodded, accepting that. Then I hope it loosens. When Avery left the shop, snow drifted gently through the air, like the city had forgotten how to be violent. She walked past Mile High Regional and felt something shift in her chest. The building had been a hiding place. It did not need to be that anymore. That night, Avery climbed the stairs to her apartment and found an envelope on her doormat. No return address, just her name written neatly in ink that looked too elegant for bad news. Avery stared at it for a long moment before picking it up. Inside was a single sheet of paper. You think this is over. You have no idea what you uncovered. Victor Sloan was just the beginning. We know what you found, and we are coming. Avery's fingers went cold. The paper slipped slightly in her grip, then she forced her hand steady and held it again, refusing to let fear take the last word. Before you go, I would love to know where you are watching from. Drop your city or country in the comments. And if you want more stories like this, make sure you like and subscribe.